Welcome to the Clever Fox channel. Today we're going to talk about and update what we know about Sars Cov2 up to this date, July 28th, 2020. We will talk about its origins, how it spreads, its effects on the body, the death rate and prevalence, the progression, reopening schools, and what to expect with COVID-19. 6 months ago, the United States was on top of the world with the best economy in history, the highest personal happiness ratings ever recorded, prosperity, safety, and world dominance. Then, one lab accident occurred in a substandard facility run by a country without the know-how or the means to manage the technology that was given to them, and the effects have been felt around the world, especially here in the United States. The virus did what an actual war could never do. It crippled our economy and created a country of scared and shell-shocked people. Trillions of dollars printed, which may challenge the US dollar for the world's currency. Our country has been completely disabled. The virus came from the virology lab in Wuhan, China. The Chinese could not build the lab themselves and had the French government design it for them. As they could not afford the original price tag of $40 million, they built the facility as cheaply as possible, with the cost-cutting affecting the safety infrastructure of the building. The Chinese Communist Party was experimenting with treatments for the HIV virus, and to do so, they genetically modified a bat coronavirus by inserting HIV genetics into the virus. This virus infected one of the workers, who is now known to be Patient Zero. This is not the first time that a virus escaped a lab in China. The original SARS virus was also the result of a lab accident when 2 workers were infected in another lab in 2003. So there is a history of viruses escaping labs in China. It is now accepted fact that is even acknowledged by the Chinese government that the wet market was not the source of Sars Cov2, and that the virus was introduced to the market by Patient Zero. The leading virologists of the world have publicly announced that they feel that this is a genetically modified virus. Their examination of the genome leaves them with no other explanation. Also, if we are to believe that this virus spread naturally from an animal to humans, it would follow that this virus would be more infective towards the animal that it originated from. However, Sars Cov2 is an order of magnitude more infective towards human cells and not the animal cells. In nature, the viral jump from animal to human would take decades to adapt to the new human hosts and slowly become more infective towards their new hosts. This virus came out of nowhere to instantly be one of the most infective human viruses humans have ever seen. It could not have occurred naturally. It is 1,000 times more infective towards human cells than any other coronavirus in history, and it just appeared out of nowhere. Virologists say that the burden of proof is on the side of those that claim that the virus is naturally occurring, and not the other way around. However, this information is very damaging to China, and our media is controlled by 6 corporations that make untold billions of dollars in China. These media companies are very reluctant to allow this narrative to spread, as it would hurt the very country that they depend on for their profits. And as history shows, any corporation that would embarrass the CCP gets kicked out of China. The CCP knew exactly what they were dealing with. This caused great panic amongst those that understood the magnitude of what happened. They immediately locked down an entire city of 11 million people. It was a complete draconian isolation and quarantine on a scale never before seen. This isn't something that a government does unless they know its true danger. They welded people into their homes and left them to die of hunger. They forced people against their will into detention centers. They built hospitals overnight. All things you would not do unless you knew just how bad it was. In the meantime, they covered their tracks. They destroyed samples of the virus, including the original sample. The lab was wiped clean of any evidence. The workers who were there at the time were all, quote, disappeared, unquote. At the time of the accident, a 2-mile radius around the lab was closed down, according to U.S. satellites, as the CCP tried to contain and clean up and conceal the accident. They prevented any outside investigators access to the lab. They convinced the head of the World Health Organization, who was a man that was placed into that position by China, to downplay the virus and tell the world that there was no human-to-human spread, even though the CCP and the World Health Organization knew otherwise. The CCP claimed that they helped the world by releasing the genome of the virus to the world, but in reality, it was a rogue scientist who uploaded the file to the internet without authorization. This scientist has since been disappeared. But the most devious aspect of this man-made outbreak was the fact that while the CCP shut down all travel from Wuhan to the rest of China, they allowed travel from Wuhan to the rest of the world, thereby seeding the world with this virus. They could have stopped the spread, but decided it was in their own best interest to let it spread to a world that was not prepared or had any understanding of what this virus really was. And with this one move, the CCP's greatest competitor for world dominance, the USA, is now completely paralyzed, demoralized, petrified, and immobilized. The CCP had several advantages in containing the virus. First, they knew exactly what they were dealing with, which is what caused their very vigorous initial and ongoing quarantine and mitigation. Being a totalitarian regime, they could use methods of control that could not be implemented in other countries, especially in the United States. They physically forced suspected victims into detention camps, which could not happen in the United States. They welded people into their apartments. They went around high-rise buildings and taped doors from the outside. If the tape was broken, the inhabitants would be sent directly to jail. They restricted all travel, and people from the epicenter could not travel to other parts of China. These are mitigation methods that could never be implemented in the United States. Once the outbreak in China was under control and contained, they made efficient use of mandatory contact tracing. All citizens' locations were monitored through cell phone apps, making contact tracing very effective. Also, your phone would tell you whether or not you may have been in contact with an infected person, which would force people into self-quarantine. If you were to break your self-quarantine, the CCP would send those people directly to jail. These are mitigation methods that could never work in other parts of the world. China is ruled by one strict government with complete control over its population. In the United States, we have individual states controlled by different governors with different methods of mitigation. And we have a population resistant to the type of actions necessary to arrest the spread of this virus. A free society is one that is ideal for the virus to spread. If you can't control the population, you can't control the virus. China has used this difference between us and them to their advantage. To date, this is what we know about Sars Cov2. It is perfectly tailored to infect human cells. It has more affinity towards human cells than any other coronavirus. Dr. Fauci himself said that this is one of the most contagious viruses that he has ever seen, with the possible exception of the measles. It is able to bind to the ACE2 receptors found throughout the body, and new evidence shows that it's also able to bind to human cells via multiple other avenues, unlike anything humans have ever encountered. At the beginning of this outbreak, the prestigious Los Alamos National Laboratory in the United States calculated that the R0 of this virus was around 5 or 6, which is much higher than that of the flu, which is around 1.3. Months later, their early paper has proven to be correct. All flu-like viruses, including SARS and MERS, do not spread asymptomatically. In fact, people infected with these viruses could not infect others until they were visibly sick. Sars Cov2 is completely different. It can be spread for days by people who show no symptoms, not even a fever. And infected people may not even test positive until at least 3 days after they've been infected. It is now known that the virus not only spreads by droplets but through aerosols. During normal breathing, tiny particles are emitted that range in size from 1 micron to 500 microns. Droplets less than 5 microns are aerosols and can be suspended in the air for hours. They act like a gas cloud. Loud talking, coughing, sneezing can all create aerosols. An uncovered sneeze can travel up to 27 feet and allow the virus to keep a room contaminated for hours. Air conditioning has been shown to recycle and blow the viral particles across rooms and to infect others serviced by the air conditioning unit. Cloth face masks and surgical masks help to limit the travel of ejected virus, especially during a cough or a sneeze, but smaller aerosol particles will still escape and linger in the room. Cloth face masks and surgical masks will not protect the wearer from these airborne particles. N95 masks help to protect the wearer from inhaling viral particles, but if the virus is aerosolized, the virus can still pass through gaps, and if the particles are small enough, can pass right through the mask itself, as they only filter down to 3 microns. N95 masks merely help to reduce the risk, it does not eliminate it. Further, the virus can enter the body if it makes contact with the eyes. Face shields and eye goggles will also help to reduce the chance of infection, but will not eliminate it unless there's a tight seal protecting the eyes. If you were to be in contact with an infected person, whether that person is showing symptoms or is completely asymptomatic with a negative test, the virus has a very good chance of entering into your body. And since this is a new virus never before encountered by humans, we have zero immunity towards it. Our bodies have no experience in combating this virus, and because it was genetically engineered to be the perfect infector of human cells, our bodies are at a disadvantage. Sars Cov2 has multiple ways of entering and infecting human cells. It can enter through ACE2 receptors, CD147 receptors, CD209 receptors, neuropilin-1 receptors, and through adhesion molecules. This allows it to attack multiple areas of the body. And we now know that Sars Cov2 uses the same strategy as HIV to evade and cripple the immune system, most likely because of the addition of HIV genetics into the virus. We know that 20% of those infected will become severely ill and will require a hospital, and that 4 to 5% of those testing positive will die. People who don't require a hospital are considered quote-unquote mild cases, but these so-called mild cases are nothing like the regular flu. Although some with mild cases will have very little symptoms, many of these people with mild symptoms will experience severe disease that can last for weeks and be left with permanent disabilities. This virus affects the lung cells, causing permanent lung damage and reduced lung capacity, endothelial cells of your blood vessels causing blood clots leading to strokes and organ damage, heart cells causing cardiomyopathies and the need for pacemakers, and kidney cells causing permanent kidney damage requiring dialysis. It can enter the brain and infect brain cells and cause a host of neurological issues like brain fog, chronic debilitating headaches, fatigue, phantom pain, and insomnia. It affects and destroys the cells of your digestive system, causing digestive problems. We now know that it can infect pancreatic cells, causing diabetes, and new research shows that it can bind directly to red blood cells, causing our antibodies to attack our own blood cells, creating massive clotting issues. Longfons, the Respiratory Disease Organization, randomly surveyed 1,600 people who tested positive for the coronavirus. The results were shocking. Even though most did not need to be hospitalized, 95% of those who tested positive report that they still have trouble with day-to-day activities 3 months post-infection. 85% of these people had no health problems prior to infection. Half of those surveyed report that they are not able to resume their normal physical activities, and 60% of these people even have trouble walking. Researchers are beginning to understand that because this virus infects human cells so perfectly, the body may never be able to completely get rid of this virus once infected. Adults and children whose immune systems were able to beat the virus may have only suppressed the virus to undetectable levels, only to have this virus return sometime in the future when stress, poor diet, or the aging process leaves the body unable to manage this virus. Similar to the chickenpox virus that never actually leaves the body and can reemerge as the shingles as we age and our immune system is not as robust. Once this virus gets into your body, it can cause death, severe symptoms, and permanent and chronic medical issues. Researchers feel that the biggest story of COVID-19 will be the number of chronically disabled people this virus leaves in its wake. In the future, we'll be talking about some kind of chronic coronavirus syndrome that will be a story just as big as the initial pandemic itself. A syndrome that will leave a huge drain to the medical system for decades to come. To date, researchers are still not sure if humans develop long-term immunity towards Sars Cov2. Antibody levels drop to undetectable levels within months of infection, but T-cell mediated responses may be longer lived. No research has shown that there is long-term immunity, and there are more and more cases of people who were previously infected getting infected again months after recovering from the initial infection. Are these reinfections or new infections? We don't know. What we do know is from a large study of other coronaviruses, which are basically cold viruses. This study followed a group of people for 10 years, testing for one of 5 different cold viruses. They found that the same people were indeed catching the same cold viruses year over year during this 10-year period. What does this mean for herd immunity towards SARS-CoV-2? We don't know, but it's not promising. As for the numbers, with more testing being done and antibody testing finding more people having been previously infected, many are conflating the case fatality rate with the infection fatality rate. But these are the numbers taking into account the newest data available. The case fatality rate of SARS-CoV-2 in the United States is currently 3.6%. while the case fatality rate of flu is 0.1%, much lower. The infection fatality rate of SARS-CoV-2 is 0.36%, which is much lower than the 3.6% case fatality rate. But we must keep in mind that the infection fatality rate of flu is only 0.01%. No matter how you look at the numbers, SARS-CoV-2 is 36 times more deadly than the regular flu, and that's taking into account the new numbers. Already in just 6 months, we have almost 150,000 deaths and untold numbers of permanently disabled victims of this plague. And that's with mitigation and social distancing and with the hospitals not being overrun. If the hospitals get overrun, as they are now experiencing in Texas and Florida, the case fatality rate will go up. What the public needs to understand is that we are just in the very beginning of this pandemic. Most scientists agree that at most 12% of the United States population has been infected, and the virus will continue to spread until at least 65% of the population has built-in immunity towards it. This means that to achieve herd immunity of 65%, a total of around 800,000 people will have died in the United States. If you look at the case fatality rate, then we can expect around 760,000 deaths. If you look at the infection fatality rate, we can expect 1.1 million deaths. At the beginning of the pandemic, the CDC classified this virus as a Category 5, meaning it had the potential of up to 1.8 million deaths in the United States if the medical system became overloaded. If this virus is allowed to spread too fast, our medical infrastructure will become overwhelmed. Currently, in Texas, they have reached their hospital capacity, and hospitals have formed what they call survival panels to turn away those they feel they cannot save, rather than to admit them at the expense of others who they feel they can more likely save. Remember, only 12% of our population has been infected, and look at the human and economic toll that it has already caused. And we are only in the very early stages of this pandemic. Like the Spanish flu, this pandemic may take years to get through. With no immunity towards this novel virus, and because it's so contagious, there is no way to stop the spread of it. The virus is like a wildfire that will burn as long as there is available wood. It can't be stopped, just like we can't stop the wind. The most we can do is slow it down enough to preserve the functioning of the healthcare system and to minimize deaths until a viable vaccine can be produced. The world's lockdowns and mitigation did indeed slow the virus. In the United States, the lockdowns were not coordinated, and citizens did not adhere to guidelines. As we said earlier, a free society is very difficult to control. Also, the mitigation efforts were lifted prematurely, which caused the spike in cases that we are seeing today, as many as 75,000 confirmed cases per day. At this rate, our medical systems will most likely be overwhelmed. Many experts believe the only way to avoid this is to enter another lockdown, then open up slowly and carefully once the case levels are more controllable. The Europeans were more effective in their mitigation due to the higher level of controls over their population and the fact that they did not start lifting restrictions until they had control over the virus. They were able to flatten and even reduce their curve. However, with the reopening of their societies, and with this virus still circulating, their cases will inevitably rise in the coming months. Their curves will not remain flat for long, and the virus will once again roar through their populations as well. And they may very well have to re-enter mitigation to avoid overloading their medical systems, which is not as robust as ours. The spread of the virus will most likely get worse over the coming months because we will be fighting Sars Cov2 at the same time we'll be fighting regular flu. As it gets colder, the virus will spread more efficiently and more people stay indoors and in closer contact with each other. As the economy gets worse and evictions and foreclosures surge, people will be forced to move in with their parents or children, which will cause more person-to-person contact with people living in tighter spaces. Another factor is that people, after having been locked down for so long, don't really care anymore and just want to get back to normalcy. They want to get back to their jobs to protect themselves financially. They want to get back to socializing with others and to live like they used to. What makes things worse is that most people don't understand how dangerous this virus really is, so they just don't care anymore. And lastly, reopening of schools will play a large role. The United States shut down its schools back in April when there was only a few thousand cases. Now, with over 4 million cases and with over 70,000 new cases per day, does it really seem prudent to reopen schools? Corporate businesses won't even allow their employees to come to work and require them to work from home. Yet it's okay to send millions of children into crowded buildings? What happens if a student or teacher becomes ill and tests positive? Does the entire school shut down to quarantine for 2 weeks? Who would be quarantined? How would you do contact tracing? Would different schools have different protocols? How would these disruptions be handled? Another issue is that many American kids are not in good health, as are their European counterparts. Childhood obesity is rampant in the United States, and obesity is the major risk factor behind age for viral complications. The largest growing demographics for obesity in the United States are adolescents. How will infecting such a demographic affect them? While it's true that some European countries are reopening schools, they are doing so now that they have gotten their cases under control. Such countries are getting a few hundred cases a day and are opening up very slowly with precautions. Is it wise for the United States to open up schools with no plan and with 70,000 cases per day? Israel opened up schools before they were ready, creating a resurgence, which caused them to have to shut the schools back down. There is a misconception that kids don't transmit the virus and are not the source of transmission. The current administration is pointing to a small study from April in Switzerland that involved 34 kids. In this study, they could not determine that kids are vectors of the virus. No conclusions can be drawn from this study, and it's not been analyzed or peer-reviewed. However, there is an actual study worth looking at from the New England Journal of Medicine from July 2020. They show that children between the ages of 10 and 19 spread the coronavirus to members of their household more readily than adults. Researchers from South Korea studied 60,000 contacts of 5,700 COVID-19 patients. They found that people are more likely to catch COVID-19 from their household, and that they were most likely to catch the virus from the age group of between 10 and 19 years old. Once you let millions of kids between the ages of 10 and 19 back to school, the very people least likely to follow CDC guidelines, transmission rates will most likely skyrocket, putting children, teachers, school workers, and parents and grandparents at risk. Imagine millions of college kids, after spending time infecting each other in school, returning home for Thanksgiving to infect their parents. This is another reason cases will spike over the winter months. Finally, a word about vaccines. Achieving herd immunity through a vaccine would be the ideal scenario, but it's unlikely for a vaccine to be available before sometime next year. The body does not seem to develop long-term immunity towards coronaviruses. This will make the development of a viable vaccine much more difficult. There are many companies trying to develop a vaccine. However, vaccine development is typically a very long process, typically taking up to 18 years. A great deal of safety testing is required. There needs to be an investigation of unexpected adverse events, serious adverse events, and rare adverse events. To get a vaccine ready in 18 months instead of 18 years would, in my opinion, require cutting a lot of corners and reducing its safety profile. As of yet, there's still no vaccine for the original SARS virus, and there's still no vaccine for HIV, which this virus has many similarities with. In animal testing for the vaccine for Sars Cov2, it was found that it caused more deaths than the virus itself. In animal testing, the vaccine seemed to provide immunity to the first exposure of the virus, but when the animal was exposed to the virus a second time, the animal's immune system over-responded to the virus, causing the animal to die. Apparently, the vaccine changed the way the animal's immune system worked in a way that was deadly to the second exposure of the virus. This is just one of the many variables that are involved with vaccine development. It's not an easy process, and if not done correctly, can have deadly consequences. The leading candidates for the SARS-CoV-2 vaccine are RNA vaccines never before used in humans. The vaccine floods the body with RNA, which are bits of genetics which enter human cells, causing them to produce antigens to stimulate the body's immune system against the coronavirus. This type of vaccine has zero safety history, and many scientists warn of unforeseen serious and even permanently debilitating or deadly side effects in humans as pharmaceutical companies attempt to play with human genetics. Remember, these pharmaceutical companies are exempt from liability when it comes to vaccines. In the end, we know this for sure. This genetically engineered virus that accidentally escaped from China and ravaged the world is more dangerous than most people realize. We are still in the very early stages of this pandemic, and we have a long way to go before life returns to normal. This is a virus that you do not want in your body, and we must as a nation try to protect those most vulnerable and to slow the spread in order to spare the medical system. We must prepare ourselves for a worsening tide of infections and all the human and economic impact it will have over the next 12 months. For as bad as it's been to this point, it will get many times worse. In time, we will eventually emerge from this pandemic, hopefully having learned valuable lessons. Please let everyone come together to help one another during these unprecedented times. While we pray and hope for the best, we must prepare for the worst. Take care and be safe. Thank you for watching the Clever Fox channel. If you like this video, please hit the like button and don't forget to subscribe.